A very good morning. So the topic for today's lecture is Introduction to Cast Metal Restorations. So what are cast metal restorations? Basically, these are the restorations which is fabricated out of the mouth in the lab from the materials like gold alloys and then cemented back into the prepared tooth. That means we were doing the direct restoration, that we are preparing the cavity on the tooth itself and then just placing the restoration. But now what we are doing, we are preparing the cavity, taking the impression, and whatever impression we have got, accordingly the cast or the restoration is fabricated in the lab, and then once we receive it from the lab, we place it back in the mouth. So this is like a indirect restorations we are talking about. So what most of the restorations what are included here is the inlays and the onlays. So what is an inlay? It is a fixed intracoronal restoration, a dental restoration which is made outside of a tooth to correspond to the form of the prepared cavity and which is then luted into the tooth. So as I mentioned, fabricating outside. Now if we talk about the class 2 inlays, in class 2 inlays the proximal surface is also involved and sometimes we need to cap the cusp, that is cusp capping is done. But yes, for inlays it is 1 or 2 cusp is being capped but not all the cusp. That is how it is different from the inlay. So inlay involves the proximal surfaces and it caps all the cusps. Yes, here you can see in the picture here, this is what an inlay looks like, and in the previous picture this is what an inlay look likes. Now indications. Yes, why we need this indirect restorations? We are very well doing the direct restoration, then why these indirect restorations? So you have to decide in which all cases you can go further, that is specific indications we are talking about. So the large restorations where we feel that the tooth surface has been destroyed, there's a large destruction of the tooth, so in those cases we need a material which provides us good strength. So large restorations where we require the higher strength and the superior control of the contours and contacts. Yes, since we are fabricating the restoration outside, that is the fabrication is being done in the lab, so it will have a better control for the contacts and the contours. Then teeth which are at risk for fracture. Yes, cases like where there is a fracture lines you can see in enamel or dentine, so it is better as a preventive measure you provide them with some kind of indirect restoration so that the strength of the tooth is maintained and the tooth can be maintained in the oral cavity for a longer duration. Then dental rehabilitation for cast metal alloys. Here you can see that rehabilitation is done with using these cast metal alloys. Then in cases where you require the diastema closure or the occlusion plane correction, mainly for the diastema closure, that means where you have to maintain the mesiodistal dimension, both inlays or onlays can be used. But when we have to correct the occlusion plane, it's mainly the onlays which are being recommended. Then indications, again the removable prosthodontic abutment, that is because they can be used as abutments for a removable partial denture. You can see here in the picture, this is they can be used as the abutments for a removable partial denture, because the advantage again will be because of the superior physical properties, they can withstand the forces imparted by the partial denture. So this is an advantage. Then again you can provide the rest seats or the guiding planes in these cast metal alloys. Now we have talked about the indications, now talking about the contraindication. There are certain cases where you cannot use these cast metal restorations. Why? Like the high caries rate, because these materials are expensive. As you can see, the lab procedure is involved, so cost increases as compared to the direct restoration. So in these cases where there is a high caries rate, so you have to make sure that you first control this caries activity, otherwise what will happen, dimensions will keep changing and again you have to change the restoration. So that is not possible to change these restorations so frequently. Then aesthetics, because they are made up of the metal alloys, so definitely they do not provide the aesthetics what is required. Then small restoration, since they require a lot of preparation, so in small cavities these restorations are not preferred. Dissimilar restorations, because they can lead to certain kind of galvanic currents or shocks, so again not indicated in such cases. So the advantages of these materials is, as I mentioned, because they are made up of the metal alloys, they provide highest strength, and since they are being fabricated outside in the lab, so definitely they provide a better control of the contours and the contacts. Proximal contacts can be made better in the lab. Then biocompatibility, because they're made up of mainly the noble alloys and the gold alloys, so definitely they provide good biocompatibility. And low wear because of the metal. Disadvantages, yes, since they are being fabricated outside, so lab procedures are involved, so increase in the number of appointments, and chair side is also increased. Technique sensitive, yes. Then cost, it is all because of the same reason, because they are being fabricated in the lab. Splitting forces, especially the small inlays, when we use them for the endodontically treated tooth. So if you're using these small inlays, they produce a wedging effect on the facial or the lingual tooth structure, and therefore can cause the splitting. The facial and the lingual surface can split. So sometimes it can happen, especially with the premolars and small inlays were being used. And the materials which are recommended are, according to ADS specification number 5, these materials from which they are made, they must have at least minimum of 75% of gold and platinum metal content to be present in alloys for a cast restoration. Mainly 4 groups are being used: the traditional high golds, low gold, the palladium silver alloys, and the base metal alloy. These are being used for the cast metal restorations. Then talking about the tooth preparation, that how you start preparing a cavity. We have already discussed the cavity preparation for the direct restorations. Here also the steps will be in the sequence, like initial preparation, occlusal, then proximal box preparation, and the final preparation. So armamentarium which is required is the Fisher carbide burrs. The number is 271 and the 169L, and a fine grit flame shaped diamond burr which is number 8862 is used. This burr is mainly used to provide the flares in the restoration or the cavity. So the outline form, the salient features is the uniform tapered walls and smooth pulpal and gingival walls. The walls have to be smooth, as when we are making the direct restoration also, we take care that the walls are smooth. All the internal line angles have to be rounded and well defined. Then vertical walls oriented to a single path of draw. Yes, this is important, because here what we are doing, we are preparing a cavity, we are taking an impression. It is with the help of a wax. So there's a special inlay wax which comes with that you take the impression. So that wax pattern has to be removed, and once it is being casted, that cast has to be seated. So there has to be a specific draw pattern for this, and that has to be a single path of draw. Then preparation without any undercuts, otherwise your wax pattern will break or it will not seat when you place it for the next time. Then gingival to occlusal divergence of 2 to 5 degrees per wall. Since when we talk about the direct restorations, we are providing the convergence, the cavities were being converged, but here we are talking about the divergence, again for the same reason, because we have to make a wax pattern which has to be removed. So we give a little divergence, and the divergence should not be more than 2 to 5 degrees. And most preferably the taper should be equal on the opposite walls. Again, the significance of taper, as I mentioned, it permits the unobstructed removal of the wax pattern and then seating of the subsequent casting. Then occlusal step, using the number 271 carbide burr, which is held parallel to the long axis of the tooth, as you can see here in the picture. This is the number 271 carbide burr, which is held parallel to the long axis. In cases of the mandibular molars, because they are slightly tilted, so accordingly the orientation of the burr has to be changed. And with this you give a punch cut to a depth of 1.5 millimeters to establish the depth. Then, maintaining this initial depth and the same burr orientation, you have to extend the preparation to the other proximal side. For example, here we are considering that the caries is present on the distal surface, so you have to extend it towards the mesial surface. And you have to keep the mesial marginal ridge intact by not removing the dentine support of the ridge. Then the facial and the lingual extension in the mesial pit region should provide the desired dovetail retention form. Yes, see here we are just taking the example that we have a caries on the distal portion. So what we have to do on the mesial side, we have to provide the dovetail. This would provide the best of the retention. So this retention will help in preventing or resisting the distal displacement of the inlay. Then proximal box preparation. with number 271 carbide burr distal the proximal ditch. Initially you made a punch cut, now what you have to do is you have to make a proximal ditch, and the mesodistal width of the ditch will be around 0.8 mm. That is 2/3 at the expense of the dentine and 1/3 at the expense of the enamel. That is how 0.5 and 0.3 counting to 0.8 mm. That is the diameter of the 271 burr. Yeah, the clearance with the adjacent tooth is same as we maintain for the direct tooth preparation, that is 0.2 to 0.5 millimeters. Yeah, this and again there's a retention feature what is given, like first was we were giving the dovetail, now this is like the facio-axial and lingo-axial line angles, we are providing the retention grooves, and these grooves can be made with the help of the number 169L carbide burr. Yeah, this is how they look like. If you see here, these are the retentive grooves. Then yes, you have to remove the remaining infected dentine from the proximal ditch gingivally, that we are doing for the direct restoration also. And yes, taking care that how much of the remaining dentine is there, on that basis either you have to provide the base or the liner and then base. Here you can see here. And bevels and flares, yes, for these restorations, the indirect restoration, this is something important, these bevels and flares are given, and as I mentioned earlier that you can use this burr 8862, which is a diamond burr, you can use them to provide these bevels and the flares. The gingival bevel which is given here is around 20 to 30 degrees and the width is around 0.5 to 1 millimeters, and the cavo surface enamel angle is around 140 to 150 degrees. This gingival bevel, it will help us in providing the lap sliding fit, and there are mainly two types of flares which are given, the primary flares and the secondary flares. So now coming to the major differences between what is the amalgam versus the inlay cavity. The outline for the amalgam will be narrow and for the inlay it will be wide. That is, the cavity width will be 1/4 of the intercuspal distance, while for the inlay it will be 1/3. And the burrs used are these burrs. And yes, the important point is occlusal cavo surface angle. In cases of direct restoration with amalgam, it is 90 degrees. But when we talk about the indirect restorations, we are providing it to be 135 to 145. And the gingival bevel is 15 to 20 for the amalgam, and for this it is 20 to 30. And flares are not given, that is one important point. So these are the major differences between the amalgam and the inlay. So this is what we are supposed to know. That's all for the lecture. Thank you.